Welcome, I'm Maureen Connolly, the editor-in-chief of everydayhealth.com and the host of Boxed In, COVID-19 and Your Mental Health. My guest today is Dr. Brian Fallon, a professor of psychiatry at Columbia University. He's also director of both the Lyme and Tick-Borne Diseases Research Center at Columbia University and the Center for the Study of Neuroinflammatory and Somatic Disorders at the New York State Psychiatric Institute. Dr. Fallon is featured in the Castle Connolly Top Doctor Directory, the official source for doctors for over 25 years. We talked with Dr. Brian Fallon for the initial Boxed In series, and I wanted to check back in with him again because he's currently leading a national study looking at how Kundalini yoga and meditation might play a role in recovering from or living with a systemic infection like COVID-19. Welcome back, Dr. Fallon.
Thank you so much. Glad to be here.
So you're a world-renowned expert in Lyme disease, and if you've noted some similarities with Lyme and COVID-19. Both, as you described, are multi-system disorders that affect everything from the brain and joints to peripheral nerves. Can you explain to me a little bit more about that?
Absolutely. I mean, what's been most interesting to me and striking to me is the overlaps between Lyme disease and COVID-19. And one of the significant overlaps, of course, is that many different systems of the body are affected. So with Lyme disease, it starts with a rash on your skin, usually, and then it goes into the tissues and then into the bloodstream, and then it goes to different organs. So it might go to your heart and cause a carditis and inflammation. It might go to your brain and cause cognitive problems or mood changes. It might go to your peripheral nerves and cause burning sensations or sharp stabbing pains or shooting pains. It goes to your muscles, causing muscle pain. It can go to your joints, causing swelling in a joint or pain in the joints. So those are the multi-system manifestations of Lyme disease. And what we're learning about COVID, of course, is that it's primarily an infection that affects the lungs, but then it also affects many different organs in the body as well, including the GI tract, the brain, the heart, nervous system, and in other ways, peripheral nervous system as well. So there's so many similarities between COVID and Lyme disease. And I think they relate to the fact that it's an infection. Both are infections that affect the body systemically. Obviously, they're not the same infection. So Lyme disease is a bacterial infection that you can treat with antibiotics. COVID is caused by a virus that requires a completely different approach, antiviral medications and anti-inflammatory medications. COVID has effects on clotting, and that can create a whole bunch of problems that are different from Lyme disease. But the similarities in what I've observed over the last 6 months is quite remarkable. So for example, early on, the question with COVID was, let's get a good diagnostic test. Hurry up, get a good diagnostic test. And so people around the world were working hard to develop good diagnostic tests. And then all of a sudden, these tests started getting rolled out. And the public assumed that these tests were going to be accurate. And the public assumed that these tests were going to be sensitive and not have false positives and not have false negatives, because the public assumes that when you develop a diagnostic test that it's perfect. And the truth is, there is no perfect test. There are better and better tests, but you need time to develop those better and better tests. So some of the initial COVID tests were very weak and had a lot of false positives and false negatives. The current tests have improved. The public has learned so much about antibodies over the last 6 months, 9 months, that I'm sure they knew nothing about before. Mm-hmm. With Lyme disease patients have known for a long time about antibodies, because the only test that was widely available for Lyme disease was an antibody-based test. So, and the problem with antibody tests is that it doesn't tell you necessarily whether you still have infection. And that's true with the COVID tests as well. So there's so many similarities. And then the issue becomes, well, what happens after you've had the infection? After you've had COVID, what happens? Are you cured? Do you have no symptoms, or are they all gone? Do you back to normal? And what happens after Lyme disease? Patients were told that they're cured. You've gotten the correct amount of antibiotics. If you have any persistent symptoms, it must be due to something else. Perhaps you've developed chronic fatigue syndrome for some reason, or fibromyalgia, or depression or anxiety has emerged. It has nothing to do with the fact that you previously had Lyme disease. And the same thing seems to be happening with COVID. So we have this phenomenon now called the COVID long haulers. And these are people who have persistent symptoms or recurring symptoms after getting COVID. Some of those patients have well-defined COVID where they had positive blood tests and they know for sure that they had it. Other people had classic COVID symptoms but never tested positive. And so they're included in the long haulers. Just like with Lyme disease, those patients who had very well documented early Lyme disease, and then maybe 10% went on to develop persistent relapsing symptoms. Some of those patients didn't have perfectly positive tests. So we know that there are problems with tests. We know that there are problems with persistent symptoms with Lyme disease. And the assumption, and what's emerging now in the observation of patients, is that there's a subgroup of patients who, in fact, are developing persistent symptoms. So let me just talk about those persistent symptoms. So with Lyme disease, one of the features of it that drove patients crazy and doctors confused them was that some days the patients would be feeling well, the next day they'd be feeling sick. And so the intermittent nature of the symptoms made it almost seem like it was psychological. You were doing it to yourself, or you're putting it on because you don't want to go to this family event, or you don't want to go to work on that day, or you're a child and you don't want to go to school, or why are you falling asleep in school? So it was presumed to be psychologically motivated, as opposed to the waxing and waning course of an immune response in response to the infection or the inflammation or whatever's going on in the system that's causing this waxing and waning course. And the same is true with what I've read about the long haulers, is that they have symptoms some days, they don't have symptoms other days. And the symptoms can be burning pains or stabbing pains, much like you get with peripheral neuropathies, which means that you've got peripheral nerves that are having a problem. And the same occurs with Lyme disease as well. And it can be worse some days, better than other days. Oftentimes, when the brain is affected, patients with Lyme disease describe having brain fog. What is brain fog? It basically means that their brain is not processing quickly enough. They can't quite follow conversations that are going too fast. They can't think of what they want to say and come out with it fast enough. They might come out with something that might be the wrong thing, so they have some verbal fluency problems. And I'm reading from the results of various studies that the same things are being reported now among people post-COVID, some of them. It's a multi-cognitive problem as well as a mood problem. So sometimes with Lyme disease patients, maybe 40% of patients with chronic persistent symptoms can have symptoms of significant depression or anxiety. Is that going to be true with COVID-19 long haulers? Perhaps. And certainly if you have pain associated with it, if you have cognitive problems associated with it, if you aren't able to go back to your normal life because of it, then obviously that also is going to have psychological sequelae.
I can't even imagine, being in that position where you've not only suffered, from the virus, right? Whatever that meant, whether you were hospitalized or just, breathing impacted for,
That's right.
And then now to know that here you are weeks or maybe months out, a variety of symptoms that can't, can they be attributed or not? So I guess the question I would have for you is, what have you learned in studying Lyme that might be applied to the way in which we're able to kind of prove, that this is in fact related? So then the question I would have is, if someone's having a flare up of symptoms again, can you get them in to do a blood test and compare it to a period where they're not kind of having these flare-ups? Is there a difference in proteins or something that would indicate?
Yeah, that's a great question. Wouldn't it be wonderful if we could have an objective marker that would confirm that this is what's happening with you and this is why you're having your persistent symptoms? With Lyme disease, we do not yet have that marker. Now, various research studies have shown that patients with post-treatment or persistent Lyme-related symptoms can have elevated inflammatory markers. They can have, if you look at brain imaging studies, you can see altered blood flow in the brain or altered metabolism in the brain. But you can't do that on an individual basis, and you can't do it on a day-to-day basis. And I suspect the same is going to be true for COVID, that there's not, not likely to be a specific marker. Now, what I can say that should be reassuring for those patients who are long haulers right now from COVID-19 is that there are self-help things that you can do to help yourself. So, for example, make sure you get good sleep. Don't push yourself beyond what you feel like you can do, because this is not who you are. I'm not someone who stays in bed 12 hours a day. But if your body is telling you to stay in bed 12 hours a day because it's recovering, then let that happen. Family members of an individual with COVID-19 where there are persistent symptoms need to be understanding and need to be compassionate, need to recognize that this is just part of the process of illness. Now, people with Lyme disease, the good news is, really do get better over time. Sometimes it's just time alone, and sometimes it's with interventions, meaning antibiotics or other medications that might help their persistent symptoms. But
So with
patients can get a
COVID,
lot better.
yeah. So I guess to your point, the biggest concern probably is like, okay, maybe I can handle this for a few weeks or months, but the fear being like, oh my gosh, is this going to be my life forever?
Right. That's a terrifying thought, right? And if it lasts for a week, that's tolerable. If it lasts for a month, it's disturbing. And if it lasts for 3 months, it causes you to have to reimagine what your course is going to be.
To go back to the point about, taking charge in terms of the things that we do know, like self-care and diet and sleep and eliminating stress, when we can, I imagine all of those things would very much be supportive and play into like helping you to recover from the virus, right?
That's exactly right. And we have a study right now, as you mentioned early on, looking at 3 different approaches to treating the heightened anxiety and arousal that patients worrying about COVID-19 might have. And they can be hypervigilant, they can be fearful, they can be worrying all the time, having either lost their jobs or lost loved ones or their own personal fears of infection or illness, having to stay home from work because their children are at home and trying to struggle with how you're going to survive, creates a lot of understandable, natural, normal anxiety. But you as an individual can help reduce that through things like meditation, yoga, and cognitive therapy as well. So in the study that we're doing, everybody gets cognitive therapy online, at home, no cost. If you go to proofpilot.com, you can sign up.
Okay, so that's pretty amazing. So you're saying that the study is still allowing for enrollment?
Oh, yeah, absolutely. So we're going to continue to enroll for several more months. Right now, we have about 160 people in the study. We want 350, so we're going to continue for another few months.
Okay. And do you have to prove that you've with the positive COVID test, or what?
No, actually, this study is specifically for people who don't yet have COVID. So this is for people who are worried that they might get COVID and are living worried or fearful lives as a result of that, or other aspects of causing.
Oh, okay. So as part of this, you're asking them to learn a type of yoga, or talk to me about
Yes.
yoga.
What's great about this study, as I've looked at this, people who have enrolled already, this is a study where everybody gets training in cognitive ways of reducing anxiety, which means focusing on how you think that's increasing your fear, and restructuring that, reframing how you think so that you can cope better with the challenges that you have in your life. So everybody gets training in that. 2/3 of the group get a mind-body therapy. One group is getting meditation, daily meditation, and we know that mindfulness-based meditation, which is a non-judgmental way of living your daily life, and teaches you how to calm yourself, quiet down your autonomic nervous system so your heart is not racing, so you're not breathing super fast, so you're not sweating. So all these things that indicate autonomic arousal gets quieted down with meditation. And the same occurs with Kundalini yoga. Now, what is Kundalini yoga? It's a combination of movement, body movements, some light stretching, as well as a type of breathing, as well as a meditation. So it joins together movement, breathing, and meditation. So we're trying to see if meditation and Kundalini yoga enhances the reduction in anxiety and the improvement in personal coping strategies that people might employ to help them in the challenges of COVID-19.
Okay. And before I kind of ask you about some of the initial, results, right, that you're finding, because I'd love for you to share, Kundalini as sort of a standalone word, right? Can you explain what that is? It coiled energy that goes up the spine, or
Yeah,
that's what I've
it's
read,
based
but...
on the Eastern traditions that we all have this internal energy that can help strengthen our body, and that if we can use that energy properly and channel it properly, that it can give us increased health in our lives.
Okay. And then the meditation component entails how much time on a daily basis?
That's about 15 minutes daily. And the Kundalini yoga is a little bit longer, about 30 minutes daily.
Okay.
And if you do that for 8 weeks, studies have shown that meditation, if done daily for 8 weeks, that can, in some studies, shown that it reduces the inflammatory marker, C-reactive protein. So there were six studies that looked at this, and 3 of them showed a definite reduction in this inflammatory marker. So it's absolutely remarkable to see that something as simple as 15 or 20 minutes of meditation a day can reduce the inflammation in your body. And we
And the
know
groups,
that reduces pain, so we all want that.
Yeah, and so it's 2 groups, right? So somebody's trying the meditation and another group's trying the Kundalini, or are you doing both?
Well, the Kundalini group also gets meditation.
Okay.
So the Kundalini group, the meditation group gets a type of breathing and meditation. The Kundalini group gets movement, breathing, and meditation. So the only difference really is the type of breathing and the fact that we have movement as well in the Kundalini group.
Okay. And tell me about what happens when one lowers their inflammatory response, or in this case, their C-reactive proteins, and how that might enhance their immunity.
Oh, that's great, because I mean, we need inflammation to fight infection. But if you have too much inflammation, that causes problems in the body. That causes joint swelling, joint pain, muscle pain. It's basically causes the release of cytokines in the body, which can cause slowness of thinking. It can cause profound fatigue. So just think about what happens when you get a cold, or when you get a minor flu, for example. You're out. You want to sleep, you want to rest, you don't want to do anything for 2 or 3 days, and then you come out of it and you're back to normal.
Mm-hmm.
But if that goes on for too long, that's likely because your inflammatory markers are elevated. So people who have autoimmune diseases, people who have psoriatic arthritis, for example, they have these really elevated inflammatory markers, and that can damage the heart, damage other parts of the body as well. So it's not good for your body to have inflammation. So if anything you can do to lower inflammation can be helpful, as long as you're not lowering it too much. We need inflammation to fight infection initially, but we want it to stop. We don't want it to continue.
What about the correlation between risk of COVID and what, I guess, a lowered inflammatory response?
That's a good question. No,
Yeah.
it's lowering the inflammatory response in a healthy way. It's not lowering the immune ability to fight infection.
Yes, but I guess I'm asking, so then the next part of that is, by incorporating a meditation practice, could you thereby be lowering your risk of contracting COVID, and or if you do, lessening the impact? I mean, I guess there's so many other factors, right?
Yeah, there's a lot of factors, but we do know from some preliminary studies that there's some strengthening of the immune cells among HIV patients, for example, who have done regular meditation. So, but it's obviously very complicated.
Mm-hmm. Yeah, right. Because it's like, well, what's your current state of health, right?
Right,
And
right.
all your other risk factors associated. So, so tell us a little bit about, I guess, some of the commonalities you found, so far with the people who signed up for the study, when they were asked to sort of self-identify and answer questions around, do they consider themselves spiritual, and maybe what that has to do, if anything, with, I guess, how impactful this work will be. in their lives?
Yeah, so we can't tell you any results of the study yet because you're not allowed to look at the treatment results until the end of the study. So I'm not going to know anything about it until the end. But what we did look was a preliminary look at the people who signed up for the study. What we found was that the majority were female, majority are slightly more Caucasians than seen in the general population. We learned that 80% of the people in this study self-identified as being spiritual, and 70% of the people said that spirituality was moderately or very important for them in their lives. And I thought that was extremely interesting because spirituality is not something that's really paid much attention to in the medical community, but obviously this is a big part, at least of the American self-identification. And certainly that's true if you look at studies in the United States, but it's also true in this study. 80% said that spirituality was important, and they didn't have to be self-identified as religious. So in
Yeah,
fact,
and they actually, you had said to us that it was related to how they kind of impacted their healing and resilience, right?
That's right. So what is spirituality? It's basically how we deal with the ultimate questions of life. How do we deal with the fact that we're going to die?
Mm-hmm.
We're all going to die. How does it deal with the fact that bad things can happen in our lives and we don't want them to happen? How do we cope with the challenges? The spirituality really is how we deal with the ultimate questions. And something like, if you look at all of the religious traditions, all of them, you'll see that they have these meditative practices incorporated into traditions. They all have rituals, and rituals are a way of focusing your attention and oftentimes quieting your mind and living and dwelling in the presence of the sacred. So even though Kundalini yoga is not a sacred ritual and meditation is not a sacred ritual, these are practices that were honed from these various religious traditions and found to be enormously helpful. And so psychologists are now, and many hospitals are encouraging meditation, mindfulness-based yoga programs to help people strengthening their coping skills.
Yeah, and so I guess in the context of COVID-19, and the role that this could play, I guess mind-body practices playing in recovery, how soon do you see the impact? You start it and you're looking to maybe get rid of those symptoms or at least reduce the
You can see the impact
LongHaulers.
quite quickly. You can
Okay.
see improvement in your arousal. You can see improvement in your ability to focus. You can see improvement in your energy within 8 weeks. I mean, we did a study of Lyme disease with Kundalini yoga, and we found that overall multi-system symptoms actually declined over the course of 8 weeks of doing the Kundalini yoga compared to the waitlist control group.
Mm-hmm.
That's fascinating.
Yeah, I think that's amazing. But I mean, I imagine after just even a couple sessions, right? Like that kind of right away, the impact that meditation can have on how you feel in a given day.
Sure.
Right?
I mean, I think it's good for all of us to quiet down. We get into these crazy cycles of work or busyness or running around, driving people everywhere, driving your children to all these different sports events, etc.
Mm-hmm.
Kundalini, with COVID-19, things are much quieter. But nevertheless, meditation is grounding. Gives you 10 minutes, 15 minutes a day to yourself to just be quiet, and that's helpful.
Yeah. And in terms of, again, going back to your experience dealing with research in Lyme, what would you want the LongHaulers to know about how to empower themselves to get the type of treatment or, that they need, right? It's very frustrating. There's a whole assortment of symptoms and they don't know who to turn to, right? Do I need a therapist? Do I need an endocrinologist? My physical, it's daunting. So where does one begin?
That's a great question. And I think partly it depends on what your symptom profile is. If it's a mood symptom profile, then certainly reach out to the mental health providers in your community. If it's a heart-related issue where you're short of breath, where you're walking up the stairs and you're having more difficulty than usual doing that, then go see a cardiologist. If you're glucose is getting out of control, that diabetes that was previously well controlled is problematic, see your endocrinologist. If hypertension is becoming a problem, so basically take advantage of both the regular, standard, Western, evidence-based medicine, but also take advantage of the mind-body therapies that can be enormously helpful.
Yeah, I love that. And I guess just to kind of wrap things up in terms of, there are support groups popping up because they
Yeah,
just were needed, right? People were saying, gosh, I feel so alone and isolated. Am I the only one feeling
that's
these weird things?
exactly right. I mean, these Facebook groups for the LongHaulers have thousands of people on them, and that's validating.
Mm-hmm.
Because previously they said, oh, what is this you're struggling with? Or what do you mean you have burning pain in your skin? Or what do you mean you feel like at the bottom of your feet, there's rocks underneath the bottom of your feet? What is that? But then if you start hearing other people talking about these weird symptoms, then at least you don't feel crazy.
Yeah.
And that's helpful.
Right, exactly. Yeah, and the hope too is that the doctors around the country will also become educated, right? Because, to be fair, I mean, this is new for them as well.
Exactly.
And
And I
so
know for a fact that there are a lot of people focusing on long haulers and conducting longitudinal studies to look at what's happened to people over time. There was that excellent cardiac study that was reported, I think, in July or August, where they found through heart scans that people who actually didn't have significant symptoms had some evidence of some cardiac changes. So we know that COVID-19 affects people in a variety of ways, some of which you're aware of now and some of which you might only be aware of months later.
Yeah, so which is a good reason. And again, just to put out another kind of alert to people that if you, just because you haven't had the symptoms, that if you've tested positive for COVID-19, you're going to want to go and follow up with your doctor and get a good physical to kind of check in and make sure, we're not dealing with heart-related issues.
That's right. And you can also go to clinicaltrials.gov and just see what studies are out there that you could, for free, get involved with so that people can monitor you over time and do free testing with you over time. That could be helpful as well.
Yeah. Okay. Well, great advice. And we loved having you back here.
I'm so glad to be here, Maureen. Thank you so much.
Okay. Thank you.
Okay. Bye-bye.
For more information and tips on navigating your health and well-being during the COVID-19 pandemic, go to everydayhealth.com/tippy.